He is recognized for 5 minutes.
Thank you, Madam Chair. Like all the members up here, we are getting constant communication from our constituents wanting more information. And I applaud all of you for being forthright with the American public. That's exactly what we need. In times like this, communication is so important. And if you're going to err on one side or the other, over communication clearly is more important than under communication. Dr. Kadlik, I had the fortunate opportunity to be with you earlier this week and see firsthand the work that you are doing to help address this issue as well as your peers. I want to talk about one of the slides you shared with me, and it was a bell curve that showed what would happen across the United States as far as the spread of this disease if mitigation efforts were not taken by the American public and in your agencies versus mitigation efforts to basically flatten that bell curve. And I think the primary purpose of that is so that our healthcare facilities and physicians, as well as the supplies, are not, for lack of a better term, overrun by a steep bell curve. Am I correct in making that statement?
Yes, sir.
And I think another way to say it too, it's not a question of if, it's a question of when the virus continues to spread across the United States, but we want to pace it out as long as possible. Is that a correct statement as well?
Yes, sir.
Thank you. One of the issues too in helping address this is the fact that we do not have enough test kits. We know that many individuals, as the my fellow member to the right of me, Mr. Raskin, pointed out, there are individuals who have requested test kits and have not been able to access them. My understanding is as late as last Saturday, ground zero in King County, Washington, that the healthcare professionals from that facility still did not have access to test kits. Mr. Redfield, do you know if that is true or not?
We have provided test kits to the health department. The University of Washington has developed their own tests.
Were those test kits available last Friday?
Yes, sir.
Thank you. And without test kits, is it possible that those that have been susceptible to influenza might have been miscategorized as to what they actually had, that it's quite possible that they actually had COVID-19?
The standard practice is the first thing you do is test for influenza. So if they had influenza, they would be positive for
But only if they were tested. So if they weren't tested, we don't know what they had.
Correct.
Okay. And if somebody dies from influenza, are we doing post-mortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when in fact it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States today.
Thank you. I want to